Hello, good evening everyone. For those who don't know me, I'm Sandrine from Savoir-Faire Women's Nutrition, and I help women deal with digestive issues as well as hormone balance. So tonight I'm going to talk about SIBO, which is a gut health condition that is very common, but lots of people don't know that they have it. So I do see a lot of patients with SIBO, and some cases can be dealt with quite easily, others can be quite complex, and I think it's important to know and to understand what you can do to help yourself. So SIBO, now, what does that stand for? It stands for small intestinal bacterial overgrowth. So not a, we're talking about the gut here. So we're talking about our bacteria, and we're talking about the balance of bacteria, which is absolutely crucial for so many of our body systems, including hormones. I have been talking a lot about hormones lately, and specifically around perimenopause, and anything we can do to help balance our hormones just helps us get through those different stages in our lives. So SIBO. Now, about 80% of people who have IBS have SIBO, and they probably don't know that. And the only way to find out is to do a test. Now, this is becoming a bit more common in the UK. It's widely available in the US, but in England, if you go to your GP, you may not be tested for SIBO necessarily. You may go down other testing route first, to then find out that there's nothing wrong with you, but you know deep down that you are not feeling great. Now let's talk about the symptoms, of SIBO. So you would probably experience bloating. That's one of the most common sign. And then, bloating, distension, goes really heavy, gas, and then either diarrhea or constipation. Okay, so that goes with SIBO. But these symptoms could be just IBS and not SIBO. So it is really difficult to identify if it is just, without testing. Okay, so I talked about the sign and the test that you can do, and you can request a test with your GP, but you can also do private tests, and that's what I work with, is a breath test. So all you have to do is consume a solution of glucose or lactulose that you drink, and then you use this breath test to measure specific gases. And in the UK, we look at two main gases. There's only tests for two of these gases. In the US, they're just working on developing a test to look at a third gas that's present in our small intestine. So these two gases are hydrogen and methane. Now, hydrogen is linked to SIBO with diarrhea, and methane is linked to SIBO with constipation. And the hydrogen cases tend to be slightly easier to treat. Methane is quite a bit more challenging, let's say. So in terms of treatment, so in the UK, the first line of treatment will be antibiotics, which are not extremely common in the UK. So you may find perhaps a private doctor who's, up to date, sort of, with SIBO and the treatments, and maybe willing to give you a prescription for antibiotics. And the one thing that the NHS does recommend for SIBO is to follow a specific diet called Fodmap, the low Fodmap diet. So you may have heard of that. Basically what it is, it's a very restrictive diet that helps you remove the foods that tend to ferment in the gut, that tends to cause this gas and this bloating. Now, the issue with the Fodmap diet is that it's not a long-term solution. And for some people, they find that they're doing great on it because it helps you to identify your triggers. You know, you may find there's a few ingredients that really makes your condition worse. And great, you know, if you find your triggers, then reintroduce everything else and see if that's done the trick. You know, it was the case for me. I did not have SIBO personally. I had gastroenteritis, had food poisoning. That's where all my gut issues started. But it was not SIBO as such. It was in the colon further down. So, but the Fodmap diet did help me to identify key triggers like cauliflower and red kidney beans. These were my triggers, okay? So you may find other ingredients completely different from another person. This is completely individual. Hence the importance of personalized nutrition, because we are all different and we all digest things differently. So the GP route, they may suggest a Fodmap diet. They may not recommend a test. You may need to ask for it, okay? Otherwise, you can go the private route. Now, when you get your results, what do you do with that? So as I said, NHS is quite keen on the Fodmap diet, but it is not a long-term solution. Really, what we want to do is to find the cause of the SIBO. Why do you have overgrowth of bacteria in your small intestine? So now there's lots and lots of reasons really, and each case is unique. So it could be because you have a low transit time. So when you eat food, your food takes quite a long time to travel down the body. And when it takes too long, then that's when the food start fermenting in the intestine. And one thing that's really important to note, to point out, is that it's really important to have enough space between your meals. So for example, you have breakfast, then you need a really good 4 or 5 hours without any food until you have your next meal. This allows your body to do its job properly and to really allow the food to move. And there is a mechanism called the migrating motor complex, basically, that helps move, you know, your stool, you know, to leave the body. And when we eat all the time, you know, if we snack, you know, on a regular basis, say every 2 hours, or, you know, if you have breakfast and then 2 hours later you have a snack, and then you have your lunch, and then maybe you have snacks in the afternoon, it just means that your body has to work all the time at digesting food and try to clear it. So having this space of time is really important to help the body do its job. So transit time could be a cause of SIBO. I mentioned gastroenteritis, you know, when you get food poisoning, that can really wipe out your gut bacteria, the good and the bad, everything goes. And then you have to repopulate all those bacteria. And if you're not careful, it's the bad bacteria that take over. So that was my case. But as I said, my case wasn't SIBO. So it could happen in the colon as well as the small intestine. Stress is another. Hi, Louisa. Lovely to see you. Hiya. Lovely. Yeah, we'll catch up. Thank you, Louisa. What was I talking about? Stress. Yes. Is a big cause of digestive issues, and can really interfere with the balance of bacteria. So something to bear in mind. So anything you can do to breathe, to help you relax your digestive system, especially when you're about to have a meal. You know, eating on the go really quickly really causes problems. You probably have noticed, you know, when you're stressed that, you know, you don't digest your food very well. So that could be a cause. Obviously, IBS could be a cause of SIBO. And then, you know, physical issues like adhesions, you know, perhaps from an operation, that can cause SIBO. And then issues with the liver and the pancreas. Now, the liver produces bile, and bile acid helps us to helps the body control the good and the bad bacteria. It actually helps to kill bad bacteria. So if we have a liver that's very congested, lots of toxins, perhaps some hormones, excess hormones floating around the body, then that could be a cause of SIBO, okay? And also people who have a weak immune system could end up with SIBO as well. Now, SIBO does cause vitamin deficiencies like B12 and other vitamins like B1, B3 as well. And also you can maybe notice sometimes that you have difficulty absorbing fat. That's another little clue, but it doesn't, mean 100% that it's SIBO, but it just tells us that there are some issues with digestion. One thing I didn't mention in terms of what could cause SIBO is medication. So anything that reduces the production of stomach acid or blocks the production of stomach acid, like PPIs for acid reflux, that will have a massive impact, because when you think about it, we need stomach acid to get rid of the bad bacteria. The stomach acid is used to break down the food, and then it travels down to the small intestine, and it should be neutralized. Basically, there should be no bad bacteria. But if we haven't got enough stomach acid, then the bad bacteria will travel down, and then that's when the fermentation starts occurring. Okay. Now with SIBO, as I said, some people will do really well on one round of antibiotics. What I use in my practice is herbal antibiotics. Basically do the same job, but much more gentle. And I'm always really careful in terms of not going too strong, depending on the person who's coming to see me. So in my program, I tend to spend a little bit of time understanding, obviously, my patient's case, their current health, and health history. Because if someone comes to me and they're really healthy, maybe exercising, eating pretty well, but they just know they have this digestive issue, we can go with antibiotics. We can go with herbal antibiotics straight away, and they will be strong enough. They're absorbing their nutrients. They will be strong enough to take those herbal antibiotics. So, and we can rebuild them quite quickly with, probiotics. Okay. If someone comes to me and they're, say, very tired, perhaps a bit stressed, a bit weak in terms of immunity, then I'll work with them to rebuild that first before we tackle, get head on and fight those bacteria. And I think that's really important, because you want your body to be able to clear toxins, to clear the bad bacteria, because otherwise everything starts recirculating and you're just creating a bigger problem. So you want to make sure your liver, that is basically the organ that filters everything in the body, filters every single toxin, filters all our blood. Our hormones go through the liver. So if the liver is congested, we need to support that before we start killing the bacteria further up the chain. Okay. So I'm really, really passionate about this, because I think there are too many people that are suffering and that do not know what's happening with their gut. So there are some tests available. They're not all available on the NHS, unfortunately. So sometimes it's about investing in your health. But it is so worth it, because you get answers. And once you get facts, we can then deal with those facts and really support the body where, there might be some weaknesses. And it happens a lot. We talked about the liver, anyone who perhaps had their gallbladder removed, may also experience SIBO, because the bile is trickling slowly. There's no container for it. So the bile won't be as concentrated and won't be able to kill these bacteria, as well as if it was, contained in the gallbladder and then excreted when needed. So there's all these different scenarios, and they are all different. And that's what makes it interesting, but also tricky to treat at times. Now, I have been trained by an American doctor called Dr. Alison Seebecker. So I did her training on SIBO, and I am now doing an advanced course on SIBO with somebody called Dr. SIBO. So really interested in this. I'm always researching the latest, discovery to help clients, especially with herbal also natural supplements, because sometimes food is not quite enough. So there we go. So if you have any questions around SIBO, then please post them below. If you know someone who maybe suspects having it, then I would really encourage to look into testing, because then Now, the tests are not 100% accurate, but it does give you an idea. And then what is recommended as well is, obviously, if you have SIBO and your gas is really elevated, you do a round of treatments, then we test again to see how this is going, and then we get it under control. And it's all about getting that balance right in the gut so that you feel great. So thank you very much for watching. I hope this was useful. Let me know if you have any questions, and I'll be happy to answer them. And at the moment, I've got a little ebook that I'm sharing with everyone called 5 Steps to Reduce Bloating After Eating. So if bloating is an issue for you, if you feel really heavy after meals and you feel that this is not quite right for you, then please download my little ebook. There's all the details on my my Facebook page, and I will put the details below as well. And there's some great tips. It's a great starting point to support your digestion. And then if that doesn't help, then obviously you can look further and perhaps look at testing as well. All right, so thank you so much for watching, and I'll see you very soon. Thank you. Bye-bye.